Pancreatitis is a serious health issue. On Animals SOS Australia, we featured the stories of both Roxy and Millie, two elderly dogs in need of treatment after becoming gravely ill. Unfortunately, their stories are far too common.
It is upsetting to see them like this, and the challenge is they can't talk to you and tell you how they're feeling. So we've got to take what the owner tells us, our imaging, our workup, and interpret that in a lot of things. And I guess at the end of the day, we want to make them comfortable. We may not always get the best outcome, but at least if we can keep them as comfortable as possible. And if we get a good outcome, amazing, but sometimes, and in Roxy's case, that may not be the case.
Elderly dogs are susceptible to all sorts of ailments, including pancreatitis, which is what the team thought may have been the case for Roxy, because a couple of days earlier, Dr. Mark had Millie in his care, who presented with similar symptoms, and indeed it was pancreatitis.
The prognosis is, I'd say, fair at this stage. So we're being optimistic that she's gone in the right direction, but at the end of the day, pancreatitis can be something they bounce back from and never happen again, or it can be, unfortunately, something that they don't come out of hospital from. Most causes is dogs getting into food they shouldn't eat, or owners feeding some fatty foods, which can trigger the pancreas to basically become inflamed, angry, and a small subset can be bacterial as well. So certainly can be painful, and we do use painkillers to help alleviate that pain, so it can be a range in that sense. Millie's doing well. She's a stoic little dog, but fortunately in her case, pain has not been one of her biggest problems. So whilst we want to get her eating, the pain part has been something that she's coped with quite well. What happens from here is basically we continue with our plan, the nurse is looking after Millie, and the beautiful thing about a feeding tube in here is that even if she's not eating, but she's bright and happy and not vomiting, we can send her home and teach the owner how to feed via the O-tube.
After intensive care, Millie made a great recovery and was able to go home. Unfortunately, she relapsed again about 3 weeks later, and with her history and age, the owner made the decision to not put Millie through repeated trauma and instead opted for the difficult choice of euthanizing her. To help ensure you can provide your pet with the veterinary care they need without cost being a barrier to treatment, check out Vet's Choice Insurance for Pets.